So let's start. So learning. Last week, we did emotions, and some of the things in emotions are going to be tied into today's lecture. So generally, learning is a behavioral change produced by repeated experiences of a situation. And supposedly, by that exposure, people learn the right way to do things, the more appropriate way to do things. And so supposedly then by that repetition, we learn things. Okay, whether it's things that you read, things that you memorize, situations that you're exposed to. So we learn by association, okay? Associating things with each other. And so conditioning is what is the process of learned associations. And the building blocks of the learning theory are classical and operant conditioning. Now, people who deal with these type of theories and apply them in clinical practice are clinical psychologists, because when we understand patterns of learning and behavior, and then we look at why people develop anxiety, specific phobias, a learned helplessness, which are common themes in anxiety as well as in depression. How do you undo, how do you undo these learned processes that are not obviously helpful? So they cause dysfunction. Whereas obviously learned things that are helpful and productive are things that we want to maintain. So yesterday I have a 14-year-old teenager who I've been seeing for quite some time. She's suffering from clinical depression, but also with that, she has a lot of negative like cognitions. Things like nothing's gonna work, nobody can help me, I can't trust anyone, no matter what, anyone does, they can't help me. Whenever I open up to people, they leave me. I'm abandoned. So these are like really heavy negative, let's say, cognitions. So part of treating this young girl is really tackling these. And then we look at, how is it that she's learned to be so helpless or to feel so hopeless. So classical conditioning is when we learn to associate two stimuli together and we anticipate events. In operant conditioning, we learn to associate a response and its consequences. And then we have observational learning, where we learn from other people's experiences. So, when your parents sit and tell you about their life experiences and what worked for them and what did not, or when you observe your parents doing things as you grow up, you learn about the world. Classical conditioning, the very famous Pavlov and the experiment with the dog and salivation. So how does a neutral stimulus become a conditioned stimulus? So when you put food in the dog's mouth, that causes salivation, and that's instinctual, not something that's learned. However, if you have a neutral stimulus, that will not produce salivation. So for example, if you show the dog a bell or a ball, that's not going to cause salivation. That's a very neutral stimulus. However, when you pair the bell with food, so every time you present food, you ring the bell, that will produce salivation, which is still an unconditioned response. We haven't conditioned, we're just pairing them. The repetition of this, okay, will then cause the conditioning. So sounding the bell without food eventually will produce salivation. And this is something that is used in animal training. How do you teach a seal to clap? How do you teach a dog to, do certain things? How do you train a horse? So this is how, this method is used in training, animal training, but also otherwise. So before conditioning, food is an unconditioned stimulus that causes an unconditioned response. Then you have a neutral stimulus, which is the bell, which previously did not mean anything to the dog. When it's paired with food, which is still an unconditioned stimulus, and it causes the salivation, which is an unconditioned response. Conditioning meaning repetition. You repeat it so that in the dog's mind, they are paired. Then eventually when you just sound the bell, which is now a conditioned stimulus, it's going to cause salivation, which is now a conditioned response, okay? And you can apply this to pretty much, anything. And so the conditioning process, there are multiple. So acquisition is the, how do you acquire that conditioning? So it's by that pairing. So, if you continuously like sound the bell and you then don't provide food, patient is going to stop gradually. Because the conditioning wears off. But you can have a spontaneous recovery if you provide the unconditioned stimulus. So if you provide food, you can have a spontaneous recovery. Generalization is, for example, somebody is afraid of cats, they're four-legged, they become afraid of dogs that are also four-legged. So they generalize the association. And then discrimination is, example, the sound of a dog and the sound of a tuning fork. They could both be high-pitched, but there's an ability to differentiate between both high-pitched sounds, and the response will be different. So in the initial stage, a neutral stimulus and an unconditioned stimulus, the neutral stimulus starts to trigger the conditioned response. So eye blinking with air puff into someone's face, okay, they're gonna blink because air is coming out of your mouth, okay? And we see that like when people are playing with kids, you kind of like, you blow air and kids, close their eyes. Eventually what happens is that you can like look like you're going to puff air out, but you don't, but then people still blink, okay? So if you're aware of these associations, how does that affect your likes and dislikes? For example, you associate a particular street with a particular smell. So there's like a bakery that you really like in that street, and so it becomes a positive experience because the bakery is, just, it's a nice smell, so you always want to take that route, versus the second street where like there's like a garbage dump that doesn't smell fine. Or attributes to a person, that person is loud, so you attribute that loudness to discomfort. And so with that comes avoidance. I have a patient who's a graduate. He graduated from college, and his dad put him in the store. They have like a private business. And so the man who's kind of responsible for training my patient, he describes him, as an older person, but who doesn't smell good and who is extremely loud. And so now my patient, who is of below average intelligence, is avoiding the store entirely. He's like, I can't go there. It's the smell, it's the noise. So he's made that association, with the place, just because it's really uncomfortable for him. So after conditioning, what happens if the conditioned stimulus occurs without without the unconditioned stimulus? So when the bell is sounded without food, repeatedly, salivation eventually slows down. But if you sound it again and if you associate it with food, you can have some recovery. So it's a weak conditioned response after a pause. All right, so it's a tendency to respond to stimuli that are very similar to the conditioned stimulus. So a conditioned response is transferred from one stimulus to another. So A dog conditioned to respond to a bell may respond to the sound of a tuning fork. And so people learn to associate things with similarities, so generalization. And discrimination is distinction between one stimulus and other irrelevant. Here you can have someone differentiate between four-legged animals. So, they're afraid of dogs, but they're not afraid of cats. They can discriminate. I mean, it can work both ways. Sometimes people make the association, now they're afraid of anything that's four-legged, or they can discriminate. And so, their anxiety can be more divided. So some applications of classic conditioning. So former drug users and the value of avoiding settings that trigger craving. So people who have an addiction, so whether they go to Alcoholics Anonymous or Narcotics Anonymous, and so in that like 12 steps or 8 steps or whatever the program is, one of the main things is to avoid people avoid settings that may trigger a craving because of the association that's formed. So maybe someone who's a recovering alcoholic, they should avoid, the group of people that they were, usually hanging out with who are drinking or substance, because when they're with that group, they start to like their defenses go down and they're more likely to reuse, or if they go to places that remind them of where when they used to drink or with substance. And the same can apply to nicotine and smoking, I've seen people who part of quitting smoking is, quitting certain hangouts with certain friends because that's really all they do is smoke or vape. And so they try to avoid these type of triggers until they feel, confident or comfortable or strong enough to, manage in these situations. Little Albert it was a 9 or 10 month old baby. And I mentioned it last week when we were talking about emotions. And so this was an example of a very unethical type of experiment where the experimenters, they would pair a loud noise, like a really loud bang with a, white rat. So it's a very benign, animal. And what happens was that this little kid, it was like learned fear, because every time they were showed the rat, there was a very loud sound, and the baby was startled. The 9 month old was startled, and so then what happened was that there was conditioning, so that now every time they saw the rat, even without the noise, they were afraid. Um, and obviously, this psychologist who was running the experiment was then discredited and, um, license removed because, what was the point? But I mean, you learn that fear can be learned. We can teach people to be afraid by conditioning them. Again, sometimes parents can do that, not fully understanding. Like when moms tell their kids, you better, or I'm going to tell your dad. So that kind of pairing with, and the way that she would say it instills this kind of fear that maybe the dad is going to hurt me, something bad is going to happen to me. So then there's that, association between events and people. And so sometimes, kids growing up fearing a parent just because they were conditioned to feel that way. Um, Operant conditioning is when you associate an action with a consequence, and that's usually like reinforcers. So whether it's a reinforcer or a punisher, and that's really the basis of behavioral therapy. So if I want to improve or increase a behavior, I will follow it by, I will, do it, I will reinforce it by whether encouragement or tokens or of will increase the behavior. However, if the behavior is followed by a punishment, technically speaking, the behavior should, dissipate or disappear. So, if every time, this teenager leaves the room a mess, and they're punished by, their gadgets taken away from them, that should, um, in theory, cause them to, tidy up their room because they don't want to be punished. So it works for some, doesn't work for others. Um, Reinforcers with younger children, like we always prefer to reinforce before we punish. So things like star charts, token economy where they collect tokens and after a certain number of tokens or stars they get a reward. So that's kind of the basis of operant conditioning. Skinner developed it. It was an experiment. So it's a behavioral technology that revealed principles of behavioral control. And so he had something called the operant chamber or Skinner's box. And in that box, they had a rat or a mouse, and they learned how, if they press a certain buzz or button, food is released. Okay, so it reinforces that you can get a desired behavior by doing something, particular. And so again, you can train an animal to do stunts or tricks by then, when they do that, it's reinforced positively by giving them food. So shaping behavior is reinforcing it towards a desired behavior. Types of reinforcers, again, reinforcers are events that should increase the frequency of a preceding response. So it could be a positive reinforcer, like adding a desirable stimulus. So, if you clean up your room, you will have extra time out on the weekend with your friends. If you follow instructions, for example, you brush your teeth, you change your pajamas, you get extra time reading a book. So it's a desirable stimulus. And usually it has to be something that is, desired by the person. Okay. So when we're designing a behavioral program, let's say for children, we'll ask parents what are the things that they like, what are the things that they don't like. If you remove, what is it that if you remove from them, is something that will, make them more likely to, engage in a positive behavior to avoid that. So positive reinforcer is adding a desirable stimulus. A negative reinforcer is not a punishment, but a really good example of a negative reinforcer is the seatbelt of your car. If you do not put your seatbelt on, there's this buzzing sound that, get that sound, switch it off, you put on your seatbelt. So it's not a punishment, if you will. As well, I tell teenagers, if you want to remove the background noise of your mom just nagging at you to do things, just get them done. So it's not a punishment. It's just, something that you don't really want to do, and just clean up your room, no more sound from your mom. So that is also an example. Um, Reinforcers could be primary, like unlearned. When you're hungry, you go eat. So that reinforces, it's a reinforced behavior, but it's not something that anyone teaches you. But then there's conditioned reinforcers. So they get power through learned associations with the primary reinforcer. And you have schedules, whether it's continuous or partial. So a continuous schedule is a reinforcer every time something happens. So every time, your child gets an A, you reward them. So it's some responses are not always reinforced, intermittent or unpredictable. And therapists or behaviorists have found that when something's continuous, it usually with time loses its meaning or its momentum, and it becomes almost like an expectation. Whereas if something is partial and it's not really predictable, it has a higher chance of maintaining a particular behavior. So with partial reinforcement, there are different types. So you have a fixed ratio where a reinforcer occurs after a set number of responses. So for example, you get your sixth cup of coffee free after every 5 cups of coffee. So it's a fixed ratio. A variable ratio, it's a reinforcer after unpredictable number of responses. So for example, people who sit at slot machines that are gambling. So not always do you hit the jackpot, not always do you win money. So you'll find that when with this type of schedule, the likelihood of people going at it and and the fact that they keep trying could be a lot higher than when you know that every sixth cup of coffee is going to be free. Fixed interval is a reinforcer after a fixed time period. So for example, we all know that we get our salaries, the last day of the month or the 2 days before the end of the month. So it's a fixed time period. It's something that is expected at a particular time. A variable interval schedule is getting a response after varying time intervals. So things like your email, Instagram messages, messages where you don't know when it's going to happen. So you'll find that you're more likely to be checking your phones than, checking the ATM because you know it's going to come at this particular time, whereas you don't know when you're going to get a response or when you're going to get an email. So having said that, things that are a variable ratio, even though they're partially reinforced, but variable ratio, variable interval are more likely to people. So if a person is to develop a behavioral program that has that, it's more likely to succeed because it keeps people engaged. How does punishment affect behavior? So a punisher is a consequence that decreases the frequency of a preceding behavior, okay? So it's a positive where you add an aversive stimulus. You add something that is, again, here it's really looking at what we don't do. Like we don't add aversive stimuli. You don't hit your kids. You don't do punishment that could be hurtful. We do more negative. So we will remove a desirable stimulus. We'll, do time out. Kids get grounded. You don't get your overtime, for example, because you didn't put in the extra hours that you had wanted to. So why would I give you the overtime? So things like that. Because with more like adding aversive stimuli, we found that it could have more negative consequences or impact. But in general, punished behavior is suppressed, but then punishment can teach discrimination, can teach fear, and may also increase aggression if you're adding aversive stimuli. So I tell parents who use corporal punishment, so if you're gonna, hit your kid or slap your kid, the likelihood of that kid then, taking out that anger or aggression on others, be it weaker than they are, is very likely. But also as they get older, that aggression can be turned toward the aggressor, which is the parent. So if now he's 5, he can't, lash out at you every time you hit them. When they're 15, they'll be able to. Okay, so again, punishment, we really keep at sort of the bottom. However, there are definitely certain situations where it is absolutely necessary. So if it's, something related to a crime or criminal behavior, you're not going to give them time out. You're going to imprison them, and obviously, with being imprisoned comes a lot of aversive stimuli. So, that's another topic where, how do you deal with people who are psychopaths, who have no remorse, and can you teach them by when they're imprisoned, Will that make sure that they don't repeat a particular crime? So, whoever's interested in criminology and the study of the pathology, psychopathology behind criminals and psychopaths, that's sort of another whole topic. So some applications of operant conditioning with sports and work, for example. So again, striving to get the gold medal and the amount of, work that goes into that, because at the end you're going to be rewarded. So, people will go to extreme lengths to reach that goal because there is a consequence. There's going to be a reward. The same as with work, if you know that if you put in more work, you get a bonus at the end of the month, you're more likely to be doing more than if you don't have that. In our lives, it's really important to state a goal and sorry about that, yeah. State your goal, monitor how often you engage in a desired behavior, reinforce the desired behavior, and then we can reduce rewards gradually. Like if we have a target behavior that we want to, let's say, abolish, let's say tantrums in a particular kid. So that's our goal. We see how often, this child engages in tantrums. We reward them when they don't have a tantrum. And then once that is mastered, uh, we can then reduce rewards. And that, again, when you look at extinction and spontaneous recovery, we want to think about that because sometimes behaviors are like improved to the point where they disappear, and then parents will tell you, well, yes, it got better, but then eventually sometimes it came back. Some behaviors came back, some tantrums came back. Then we say, okay, let's, go back to that behavioral program and target it. Um, uh, so it just is very logical and common sense, but it's really important. Remember when we talked about in the lecture about like the psychological testing, and we looked at whatever behavior that you have, you need to work backwards. You need to look at what are the patterns, the trends, things that lead to a particular behavior. And then once those are identified, you can work around them versus, dealing with the end result, which is, okay, he had a tantrum, okay, then just give them time out or punish them. It doesn't really solve the problem. It does not, again, there is punishment. So every time they have a tantrum, you, remove privileges, you give them time out. It just adds a bit more frustration. Whereas if you worked backwards as to what led to the tantrum, and sometimes kids get into tantrums because they want attention. They know that every time they throw a tantrum, they will get your attention 100%. And so we tell parents, ignore when they have that tantrum, ignore it. And when they are calm, then give them the attention. So eventually with time, they realize that, in order to get my parents' attention, I just need to be more calm. Again, just an example of, but again, when a behavioral therapist sits with their client, it's extremely detailed in terms of what they look at as trends and patterns and predisposing events. Learning by observation and imitation of others. So modeling, it's really essential. Kids look up to their parents because those are their role models. But what if you don't have a role model, Then what? People can seek people in the public eye. So, a certain footballer could be a role model for, things that they do like charity, good deeds. When I was doing my residency, there was like big brothers and big sisters, like these are associations, and they were helpful for kids who come from single parent families where they don't have siblings. And so sometimes it's important to have like a big brother or big sister that's a role model. They teach you through modeling. Because again, they talk about mirrors in the brain, that certain things that we observe become imprinted in our memory. And I don't we talked about sometimes where, kids can do things even if they're not in their immediate environment. So they start using swear words, or they're hitting, and where when in the household these types of behaviors don't exist. And so it's more like they've seen it elsewhere, it's kept in their memory, and then it's recalled whenever they're like stressed or don't get their way. And so then, and if you remember the example I gave you, where this child was taken through different rooms, and in one of the rooms they saw somebody like going at a punching bag, like, hitting it, and screaming and yelling. And then they were taken into another room where there were so many toys that this child really wanted to play with, but then they were not given that opportunity. And then they're taken to a third room, and there was that punching bag, and they saw that this child was at the punching bag because they're so frustrated. So they learned that that's how frustration can be let out. So if you are angry and you take it out on others, like dad is angry, mom's angry, they take it out on their kids by yelling and screaming and hitting, you are modeling a way of stemming off anger. And so these kids learn that, that's how we do it. So they go to school, they hit other kids, they scream and yell when they're angry, versus being able to identify the thoughts and associated feelings, and then being able to calm themselves down. So these are really very powerful. Bandura's experiment was that where you learn, like it's almost learned frustration. Observational learning is could be a model of good prosocial behavior. When we see positive behaviors around us, it becomes something that's learned. And so you could learn to be empathic, you can learn to show kindness, depending on the environment that you're in. But also you can learn antisocial behaviors, TV and media and social media, and then violence, and how that can affect kids. A very common question parents will ask is, violent movies, violent video games, does that make children more aggressive and more violent? So we always say it really depends. It depends on the kid. It depends on, how much screen time they have. And it also depends on their environment. If the environment models aggression, and this child is on violent video games or movies most of the time, then they haven't learned anything else otherwise. So they don't know how to express themselves otherwise, because that's all that there is in their environment.